today let's start with chapter number 16, health facilities and our government, right? So let's study about the healthcare in India. So in democracy, the function of government is to look after the welfare. भाई जो हमारी डेमोक्रेसी फॉर्म ऑफ गवर्नमेंट है और यहाँ पे इसका क्या काम है, लोगों का वेलफेयर करना. So the provision of health, education, employment, housing or the development of roads, providing clean drinking water, electricity. So generally health means the ability of people to remain free of illness, disease or injuries. But the word health, it conveys more positive concept that mere absence of disease. So we are healthy if we are active and in good spirit, whatever we do. So if you are dull, inactive, then you are not healthy. So all these aspects are the part of health, and there are other factors that also affect our health. For example, people require a pollution-free environment and clean drinking water to remain healthy. On the other hand, if people do not get adequate food or starve, it will lead to illness. वही बीमार हो जाएंगे. Proper amount of खाना नहीं मिलेगा खाने को, तो हम क्या होता है, बीमार हो जाते हैं. So those who are poor in the first place to be understood, unnourished, and these families do not eat as much as they should. जितना उन्हें खाना चाहिए वो इतना नहीं खाते, right? So they are not provided basic necessity like clean surrounding, balanced diet, clean drinking water. एक proper amount of housing facility नहीं है. They are more likely to fall ill. वो ज़्यादातर क्या हो जाता है, बीमार हो जाते हैं. So many rural areas have few health centers and they do not run properly. Even private health services are not available. बहुत बार क्या होता है कि जो private health services हैं वो भी हमें available नहीं होती. So healthcare is based on health education. So health education is a part of education, but not all its aspects are taught in properly. So that is why people are not aware about the concept of balanced diet, good hygiene, and safe or clean drinking water. Now healthcare in India. So we can say in India it is often said that government is unable to provide health services for all. कि गवर्नमेंट क्या कर रही है, सारी हेल्थ सर्विसेज प्रोवाइड नहीं कर रही है सबको, because it does not have enough money and facilities. But the government had a wide network of health centers, hospitals, blood bank, laboratories for testing and ambulance. India has the largest number of medical colleges in the world and a large number of doctors, clinic and hospitals. And 15,000 new doctors qualify every year, right? And there are only 2717 hospitals in India. And in 1991 there was 11,174 hospitals. धीरे धीरे वो क्या करे, ग्रू करे. And many countries people come from treatment in some hospital in India. They are compared with the best known world, with the cheaper. And India is the 4th largest producer of medicines. So about 5 lakh people die from tuberculosis every year. This number is almost unchanged since independence. Almost 2 million cases of malaria are recorded every year. This number not decreasing. The reason behind the situation is that in the first case, most of the doctors, they settled in urban areas to earn and prosper. So they do not like to go to the village for the lack of facilities like clean drinking water, regular supply of electricity, clean environment. The rural people cannot pay more to the doctor. The medicines are too expensive and all these medicines could not be sold like this. So what do we do? Because they do not deal with the large number of poor patients seeking free service and free medicine. Now public health. The state government is responsible for planning and carrying out monitoring schemes to improve public health. It gets financial and technical help from the central government. भाई financial help भी लेता है और technical help भी लेता है. The state government runs hospital and health centers in urban and rural area of the state to provide medical treatment to the public at reasonable cost. ये medical treatment देते हैं public को at reasonable cost, and these are run mostly out of taxes paid by the public. And the state government arranges for sanitation, right? And it also organizes different kinds of health camps in the state to vaccinate people against disease. ये conduct करते हैं free medical tests, and they are responsible for giving health information to people, especially in the local language. It employs health workers to work among and tell the people how disease can be prevented and treated. The state government set up and runs a various institutions to train pharmacists, nurses and other types of health workers. And the health services provided by the state government reaches to with the chain centers. At the village level, there is usually a small health center where minor illness can be treated, and the village health centers is under supervision of PSCs, means primary health center. So PSC का क्या काम होता है? ये सुपरवाइज करता है हेल्थ सेंटर्स ऑफ सेवरल विलेजेस. ये क्वालिफाइड डॉक्टर होते हैं. व्हाट आर दीज? दीज आर क्वालिफाइड डॉक्टर. दे रेफर सीरियस इल पेशेंट टू बिगर हेल्थ सेंटर्स, जैसे डिस्ट्रिक्ट हॉस्पिटल हो गया, जहाँ पे आपको टेस्टिंग और अच्छे ट्रीटमेंट की फैसिलिटीज मिलती है. Cities usually have large government hospital where all kinds of illness, चाहे वो माइनर हो चाहे वो मेजर हो, उसको ट्रीट करा जाता है. एंड जो पब्लिक हेल्थ सर्विस होती है थोड़ी चीप होती है, बट दे सफर फ्रॉम शॉर्टेज ऑफ मेडिसिन. यहाँ पे आपको मेडिकल इक्विपमेंट में नहीं मिलेंगे, बहुत बार मेडिसिन नहीं मिलती है. सो हॉस्पिटल बेड्स अवेलेबल नहीं होते, क्वालिफाइड डॉक्टर नहीं होते, ट्रेन्ड हेल्थ वर्कर्स नहीं होते, पेशेंट्स नहीं होते, और ऑफ्टन क्या होता है कि पेशेंट्स कंप्लेन भी करते हैं उनके बारे में. Now, besides public health service, various private health services are available. Many doctors run their own clinic, and there are also many privately run hospitals and nursing homes, जहाँ पे आपको अच्छा ट्रीटमेंट मिल सकता है. But they are mostly found in cities, and besides they are run to earn profit and therefore very costly. Increase profit, the doctor at private health center ये often prescribe करते हैं more tests and medicines. India has large number of doctors and health centers. Some of the hospitals have facilities that are among the best in the world. Many people visit India as a medical tourist to get treatment in India. Often what happens, the people cannot get timely medical help and they have to travel long. What they do, they travel long distances to reach a health centers, and many cannot bear the cost of medicines and medical service. So what happened? Private health facilities, urban areas have large number of doctors जो अपने private clinics चलाते हैं, and there are hospital and nursing home that are privately owned, and there are many laboratories that do test and offer special facilities, जैसे एक्सरे देते हैं, अल्ट्रासाउंड की फैसिलिटीज देते हैं. And we can say private health facilities, they are not owned for control by the government. In private facilities, patients को क्या करना होता है? Lots of money pay करना होता है, right? Now only a rich can afford them, but they give all facilities. खाली जो rich लोग हैं भाई वो उसको afford कर सकते हैं. Registered medical practitioner, they can treat only common illness, and often the villagers have to go to cities for special services. Now healthcare and equality. In India, private health services are increasing, but public services are not. So these private services, they are available in urban area. As the services are run for profit, जो cost of services है या तो वो ज़्यादा हाई होती है या बहुत मुश्किल से मिल पाती है. They both urban and rural people, they prefer to pay and seek the high quality services provided by private doctors. There are many reasons for such better medical attention and cleaner environment. Even those who are poor, they go to private clinics and hospital in the hope of better treatment and faster recovery. So what happened? Often they have to borrow money or even sell belongings to bear medical expenses. Some private health service providers, they prescribe unnecessary tests, medicines and injection or saline glucose. Most of the time what happens? The problems gets complex as poor people usually suffer from hunger, malnutrition, और वहाँ पे lack of proper food होता है. They tend to fall sick repeatedly. Poor sanitation facilities, pollution or unsafe water for make user situation worse. Educate healthcare is not available. No responsibility. No doubt, responsibility of the government to provide quality healthcare service to all its citizens, especially the poor and the disadvantaged. So health is as much dependent on basic amenities, balanced diet, clean drinking water, and we can say that clean environment and good economic condition of the people as its own healthcare service. Now basic amenities will help to prevent illness and disease, so the government must work on both prevention and cure to improve the health condition of all the citizens. So what in 1996 government of Kerala, state in India, gave 40% of the entire state budget to the panchayat, जो आपको basic amenities provide करेगी, right? These effort is going and storage of doctors, shortage of doctors, medicines, hospital नहीं है, लोगों को अच्छे से treatment नहीं मिलता. तो government of Costa Rica in South America decided not to have an army. So it spent the money which was earlier used on army on the health and education of the people, which are the basic needs. So we can say that nutrition, safe drinking water, sanitary housing, Costa Rica is now considered to be one of the healthiest country in the South America. Right? This is all about in this chapter. Now we will do the exercise. First is tick the correct option. Dash is better than cure. So prevention is better than cure. Pulse polio campaign on certain Sunday is known as. Now pulse polio campaign on certain Sunday is called Pulse Polio Sunday. Right? Now lack of proper food. जब आपको proper food नहीं मिलता उसको हम क्या कहते हैं? Malnutrition. Public health service is a chain of health centers and hospitals या both. Now fill in the blanks. Public health services is a chain of health centers and hospitals run by the. कौन run करता है? Government. It is not dash to be dull, inactive, anxious or scared for a long stretches of time. It is not health. Urban areas have dash number of doctors, large number of doctors. Educate health is not available to all citizens in India. Village health workers can treat dash illness. Village health workers, वो आपके खाली जो minor illness होते हैं उनको treat कर सकते हैं. Now match the following. Tuberculosis, it's a disease. Primary health centers, healthcare, rural area. Jeep, mobile clinic, X-ray laboratories. Rich people, private schools, private hospitals. Now write T for true and F for false statement. Health services in India are cheaper than other countries. False. Women generally are not taken to doctor in prompt manner. It's true. Most people are aware about the concept of balanced diet. False. People are not aware. The undernourished poor people are likely to fall ill. It's true. Health means only to remain free for illness, disease. False. आप mentally भी बिल्कुल क्या होने चाहिए? सही होने चाहिए, healthy होने चाहिए. Now answer the following. The Indian government is yet to provide quality healthcare facilities to all citizens. Justify the statement. Write in detail about public health services. What are the difference between private and public health services? Write a note on private healthcare centers. Why do the new doctors avoid rural area? Describe the network of public health services. Right? These all are the exercise that we have done. Hope you understood each and everything. Now let's meet in the next class.